All right, it's just about 4 o'clock, so we'll get started here. And welcome everyone to today's Tuesday talk session. I'm Taylor Noctani. I'm the operations trainer here at Joyce University of Nursing and Health Sciences. And for those of you who don't know, Joyce University was originally founded in 1979 and were previously known as Ameritech College. Joyce University is an NWCCU accredited university and known for being the largest pre-licensure nursing university in Utah. We offer nursing programs from the associate's, bachelor's, and master's levels, as well as a health sciences program for occupational therapy assistants. And today we'll spend about 30 to 45 minutes or so discussing the future and details of the next generation NCLEX as the ever-evolving assessment tool for nursing licensure, led by Dr. Jaimee Kastler, who is the nursing program's quality manager here at Joyce University. We'll have plenty of time for each of you to ask any questions from our experts on today's call, and as well as put any questions in the Q&A section at the bottom of the screen. And so with that, I'll turn the time over to Dr. Kastler to introduce herself and get started.
Hi, good afternoon. I am going to share my screen to start my presentation. So while I'm getting that set up, I will tell you a little bit about my background. I graduated from my first program in 1999. So I worked as a nursing assistant while I went to school to become a licensed vocational nurse, or LVN. From there, I went back to school to get my associate's degree in nursing. And then I went back and got my master's degree in nursing and then my PhD. So that is a little bit about me. I have been at Ameritech, well, it used to be Ameritech, now Joyce University, since 2019. I started adjunct, then worked as a full-time professor, and now I'm working in the nursing program's quality manager. So today we are going to take a look at the NGN or NextGen NCLEX. Exactly what is this thing that everyone keeps talking about? That will start April 1st. So we're going to talk about what it is, why did it change, the clinical judgment measurement model, which is how they are looking at the different types of questions and the abilities of the students who graduate and take it. And then we're also going to look at the new question formats. There are multiple new formats that go along with the new types of questions. So first of all, let's define some key terms. Who is the NCSBN? The NCSBN is the National Council of State Boards of Nursing. It is an independent nonprofit organization, and it supports nursing regulators to help ensure that the nurses that go into the field are competent and safe to practice as a nurse. The NCSBN does a lot of research, and whenever they do the research, what they're looking for is what is needed for novice nurses to be safe and to practice once they start out in the field. So every 3 years, they do a survey, and then they will actually go around and they'll follow new nurses to see what it is they are doing in the practice setting. And they want to make sure that they're testing what actually needs to be tested. They will form a blueprint or a test plan for the exam, and it lays out all the content that will be covered on that exam. And then every 3 years after they do the assessment, they'll go back through and they'll adjust and update and let all of the programs know what adjustments and updates were made. The NCSBN is the governing body for the NCLEX exam, or the National Council Licensure exam. And this exam is required after students graduate from nursing school before they can practice as a licensed registered nurse. They are also in charge of the NCLEX-PN for the licensed practical or vocational nurse. So they are responsible for both of those. And then there's something called the next generation NCLEX. So we used to hear about just NCLEX, and now next gen, next generation, NGN NCLEX. And this is a mixture of what they are calling traditional or the old type questions, and then the new format. And the reason that it changed is because they needed a better way to measure the ability of those test takers for clinical judgment. And we will discuss what clinical judgment is, looking at the measurement model that NCSBN came up with. Okay. First, why did they have to change? It's not because they're mean. It's not because everyone got comfortable and we were really good at teaching students how to take the test. It's because client safety is always paramount, and it's always something that is the most important thing whenever we have novice nurses going into the field. Healthcare changes, and so the roles of those new nurses does change. As it changes, we need to be able to change with it, and NCSBN recognized that they needed to change as clinical judgment became more and more important in the nursing profession. Okay. So part of what drew them to finding a way to measure clinical judgment are statistics. So they looked at, and if you look here, in 2016, the national pass rate for first-time attempt for NCLEX was 84.3%. Also in 2016, there was a study that was done that showed that only 23% of novice nurses were practice ready. And this really got NCSBN thinking and looking more into the research and what they can do to better prepare students. And so this is what started the process back in 2016, was looking at that disconnect that was there. In 2019, our NCLEX rates went up nationally to 88%, but the practice readiness scores continued to fall. So they fell down to 11%, and then in 2020 down to 8%, even though the pass rates kept going up. So it was the disconnect between being able to pass NCLEX, and then whenever they go out and they become novice nurses in the field, not being prepared or able to perform the way that the consumers wanted them to perform or needed them to perform, that they decided we really need to get this ability to measure clinical judgment in a quantitative way. And that's very research-based, but actually being able to find a valid and measurable tool to say, yes, our nurses, when they get their exam, when they pass their exam, they can think like nurses need to think. And that's going to lead to safe, competent care. Another thing that they started to see looking at statistics was that 50% of novice nurses were involved in patient safety errors. And we hear about patient safety errors quite a bit in healthcare. And so whenever they took a deeper dive into it, 50% of those that involved nurses involved novice nurses. Of that 50%, 65% of those errors were linked to poor clinical decision-making. And so that just further supported the need for clinical judgment. 20% of the employers report being satisfied with clinical decision-making skills. NCSBN found that out by actually having people follow around novice nurses and then speak to the different members of the team. 46% of tasks performed by the novice nurse now require some form of clinical judgment. So it's no longer just doing what the physician says to do or the healthcare provider says to do. They're actually required to make their own decisions and act on those decisions. Client acuity is increasing. It continues to increase, which means that novice nurses now are taking care of clients that are more acutely ill, which requires more of them. And for those reasons, the NCSBN came up with something called the Clinical Judgment Measurement Model. According to NCSBN, they define clinical judgment as the observed outcome of critical thinking and decision making. So it's not just the ability to think critically or make a decision, it's the fact that they can actually act on that. It is an iterative process that uses nursing knowledge to observe and assess presenting situations, then identify and prioritize clients' concerns, generate the best possible evidence solutions, and then to actually deliver that safe care. So it is all those parts, which is how they came up with the visual depiction of the model. The very, very basic level, which is layer 0, that is what we do. We see a need and then make a decision. So as a nurse who would go in, they see a need, they make a decision. There's no thought process behind that. It's just they need water, I'm getting them water. That isn't always the best thing for the client. So the client might not be able to drink water. Maybe they're not supposed to have anything by mouth. Maybe they're restricted on what they can drink as far as the amount per day. That involves more thinking, and that gets down into these different layers 1 and 2. The questions on NCLEX will all sit in this layer 3, and that's why I have it circled. It will always work in this sequence in the case studies, starting with recognizing cues, going to analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. So when we look at the NCLEX NGN questions, they are going to focus on this 3rd layer of the clinical judgment measurement model. Layer 4 is also mentioned in the NGN world, and that's because it's looking at environmental factors and individual factors. So they might include some of this in a question. So what I mean by that is if they're looking at a question that the test taker needs to recognize the abnormalities of the labs or the assessment, they can put in there that they're in a med-surg floor, or they're in an emergency room, or they're in a clinic. That environmental factor can affect the outcomes of what they decide to do and what they're able to do, as well as the decisions that are made by that nurse. And they might also have individual factors. They might say that if you are the charge nurse looking at this situation, what would be the response? If it is a novice nurse looking at this situation, what is the response? So they can pull in these different environmental and individual factors when they're asking those questions. Okay. Within the 6 levels, real quick, recognizing cues basically means that test taker just has to look at that client chart and say, this is not normal. So it's just being able to recognize what is normal, what is not normal, looking at all of the data. So looking at the client's history, looking at their labs, looking at any other nurses' notes, physicians' orders, vital signs, anything that pertains to the assessment of that client. So simply, can they recognize that something's not right and what isn't right? Then they go down to analyzing those cues. And in addition to being able to say, this is not right, and my client should not be presenting this way because it's not considered a normal finding, they have to be able to link that to an actual problem or concern or client need, but they actually have to make that linkage between what is going on with this client, what's abnormal, and then why might it be abnormal. After they do that, they'll get a question about prioritizing hypotheses. And this is just making sure that the test taker can establish priorities of care. So what are the different things that the client might need? And then what priority are we going to put that in so that they get the care in the order that they need it? 4 would be generating solutions. And this is testing the test taker's ability to identify expected outcomes, nursing interventions, potential healthcare provider orders that would need to be done in order to meet the client's needs. Taking action, and that's just making sure that the test taker has the ability to implement the appropriate interventions. So they might get questions actually asking them what would be appropriate, inappropriate. They might get something that says, list of the following interventions, actually mark which ones would be appropriate, which ones would be inappropriate, which ones would be indicated or not indicated. And then evaluating outcomes, and that's simply testing the test taker's ability to evaluate the client's response to interventions that were done. So that is kind of the setup, and we will look at the actual questions after we talk about how the exam itself will change. The exam itself will now be 5 hours maximum, so no more than 5 hours. The test takers will have 85 minimum questions up to 150 maximum questions. Within that 85 to 150 total questions, 15 of those questions are not scored items. NCLEX always has items that are not scored, and it gives data to NCSBN whenever the test takers take these questions, and it determines how good of a question it is and the difficulty level of the question, if the question needs to be tweaked or rewritten. So that's the purpose of the unscored items. So they will always be within the first 85 questions. 70 will be scored, 15 will not be scored. The unscored items can be NGN style questions that are unscored. So they can get traditional or NGN style questions. Those 15 unscored can also be in the form of another case study. So there will be 3 scored case studies. They will occur within the first 85 questions, and they will be scattered. So the test taker will get some standalone questions and then a case study, which has 6 questions in it, always following that clinical judgment sequence. And then they'll get more standalone, and then they'll get another case study, then more standalone, another case study. So they'll get those 3 case studies within that first 85. Those are scored. They might get an unscored case study. So if you are getting ready to take your NCLEX exam and you go and you take it and you say, wait a minute, I had 4 case studies. You said I'd only have 3. Only 3 are scored, but you can get unscored as well. If you do the unscored case study, since there are 6 questions, it counts as 6 of those 15 unscored items. So then you won't get as many of the standalone unscored items. If you take away the 3 case studies that are scored that have 6 questions each, that's 18 questions. That leaves you with about 52 to 117 standalone items. Within those standalone items, about 10% will be the NGN style standalone question. Okay. So what types of questions will we have? You will still have traditional questions, which is multiple choice, select all that apply. The 2 new ones that would be standalone only are called trending items and bow tie items. And we'll see an example of both of those. The types of questions that can be in the case study, there can be multiple choice in the case study. There can be extended multiple response, which is going to be a little bit different than your traditional select all that apply multiple response. And I'll show you the difference in those as well. There will be highlight options, drop down, and it can be drop down rationale or drop down close. I have examples of both. There will be matrix questions, which a matrix is basically just a big grid or table. And that can be select all that apply or multiple choice. And then there's also drag and drop. And on the exam now, they do have ordering, which is like a drag and drop. And so they still have that option to drag and drop, but it'll be within that case study. So now to see what they look like, here's your traditional multiple choice. There's a little bit about the client, and then there's the question stem, and then we have to answer the question. It's a radio button. So anytime you see a circle that's called a radio button, you can only choose one option. If you choose one and then you click on another one, like if I chose 4 and then I decided I want 2, 4 would go away, 2 would show up. So only one can be chosen. There will still be regular multiple choice. That's not going away, but that should look familiar. Select all that apply. There will still be standalone select all that apply. Again, very, very short scenario or information about your client. This one happens to have graphics with it. You'll still have graphics on some, but not all. And then you have your question stem. And then it says select all that apply. You're going to select one of them, all of them, anywhere in between, whatever is appropriate. You can select every single one on select all that apply. You can select just one. And then you can select anything in between. Anytime there is a square instead of a circle or radio button, it means you can have multiple answers selected. The big difference between the traditional select all that apply and the NCLEX that's coming up starting April 1st is even the select all that apply standalone will be partial credit. So currently, until April 1st, anyone who takes NCLEX, if they get a select all that apply and they only get 2 of the 3 correct, it is considered a missed question. So they don't get any points at all. It's all or nothing. They have to get all 3 of 3 correct. Starting April 1st, if they select 2 correct and 1 incorrect, they will get partial credit for what they do know. And I'll talk about the scoring at the end. The new standalone would be trending. That's one of them. Trend items, they are individual standalone items. And they have the test taker review information that's gathered over a period of time and then answer the question. The example happens to have a flow sheet. They will not always have a flow sheet. So they can have nurses' notes, and this has the intake and output flow sheet plus nurses' notes in it. They might have a flow sheet and then another tab for nurses' notes. They might have intake and output, vital signs, medications, diagnostic results. They might have progress notes or consultant notes from physicians. But what you're getting is information about the same thing over a period of time. What is trying to be determined is, can the test taker identify that there is a trend of something abnormal going on? So this one has over from 10 o'clock to 2 o'clock to 6 o'clock. The baby was taking in formula. Now they take in formula and they have emesis or they're vomiting, which is seen in the nurse's notes. So given this information about this specific client, answer this question over on the right. All of the NGN questions will have the chart on the left and then the question that needs to be answered on the right. So that is your trending. That one happens to be select all that apply. It can be any of the item types. So it won't always be select all that apply. This is a bow tie standalone. The bow tie over here again, the left-hand side, that is going to be your patient chart, client's chart, and the test taker should always start by reviewing the chart and finding out what's going on with the client. Okay. One special thing about the bow tie standalone questions is that these item types will address all 6 types of the clinical judgment measurement model. They do not do it in sequential order like case studies do, but they do hit all of those 6 parts of that clinical judgment measurement model. So the test taker starts by reading the scenario and looking at all of the information on the left, and they're going to recognize the normal versus the abnormal findings, and that's where you get the recognizing cues. Then they need to be able to understand the possible complications or medical conditions that the client could be experiencing that's connecting. So that would be your analyzing cues, because you're connecting the abnormals to what could possibly be going on. And then they need to identify possible solutions to address the client's needs and issues, and that's where you get the generating solutions. The test taker will then look at the bow tie items on the right and determine the most likely cause of the client's issue, which is in the middle. And that's prioritizing hypotheses, the appropriate actions to take, which is on the left. That's your taking action part of the measurement model. And then what to monitor once the interventions have been completed, and that would be evaluating your outcomes. The way that the bow tie works is you just grab one of the boxes and you move it up. The reason it's called a bow tie is because if you look up here, it looks like a bow tie. Multiple response, so the extended multiple response items can be select all that apply. It's just instead of having only the question stem with the potential answers, it provides you with the the patient's chart as well. So you will have the different tabs for your client's chart and go through and read all of those, then look at the question and choose the appropriate answers. With the select all that apply, one can be correct, all can be correct. And there will at least be 5 options, and then there will never be more than 10 options. So you can have 10 options there, and they all 10 could be correct. The other extended multiple response is a select N. So after the question, it says, choose the top 3 priorities. It's actually telling you how many to choose. That just means that you can only choose 3. Once you choose 3, the others will gray out. It won't let you click any more boxes than those 3. Extended multiple response grouping, still the multiple response, but it's within a body system or a group, and that's why it's called grouping. And it says you must select within each group at least 1, but you can select up to 4. So the format looks a little bit different. It's still select all that apply. Highlighting, there's highlighting text and highlighting tables. Highlighting text simply means that you're going to look at the client's chart, get all of the information needed, and then look at what the question is. And here, click to highlight the findings that show worsening of the client status. So the test taker would read this and click the areas that are deemed worsening in a client status, and then submit. Highlight table is the same thing, only in a table format. This works really well for anything that is that can be graphed. So vital signs, labs, intake and output. And they just click on, so this one was indicating improvement of the client's condition. And so the test taker would just go through, look at all of the different labs and say what was showing an improvement of the condition based on the labs. Then there's drag and drop rationale. Grab the square, pull it up to the appropriate box to complete the sentence. The item will have 1 sentence with 1 cause and 1 effect, or it can have 1 cause and 2 effects. So it can just be This one, the nurse determines that the client is experiencing blank as a result of blank. So you just fill in the cause and the effect. It could have two effects. So it could say as a result of blank and blank, and then you have to have two effects. But you just grab it, drag and drop. This is the same idea, only instead of the boxes down here, you're going to click. So you click to open up the potential answers and you choose whichever answer is appropriate to complete the sentence. Matrix multiple choice. The biggest thing with the matrix multiple choice is that it looks complicated and it looks really busy. The trick for test takers is to look at it individually. So look at just this potential order and look at just this potential order. So when we teach students how to answer select all that apply, we say look at each one as a true or false statement. Don't look at all of them all together, just one at a time. Is it true or is it false? So for the matrix multiple choice, would an echocardiogram be anticipated? Would it not really be necessary, or would it actually hurt the client? Looking at it one at a time. Okay, there can be 2 or 3 options. So you can have 2 columns. This one has 3, but you can only have 2. You might have anticipated or non-essential or correct and incorrect, or you can have the 3. There will be at least 4 rows and you can have up to 10 rows. So just do 1 row at a time. Matrix multiple response, that's a lot more like your select all that apply. With the matrix multiple response, each column has to have one thing checked. But when you look at the rows, you can check all of the boxes in each row. There can be between 2 and 10 columns on the matrix multiple response, and there can be up to 7 rows. There will always be at least 4 rows. With the matrix multiple response and the matrix multiple choice, you have to answer in each row. And for this one, you have to have 1 in each column or it won't let you move on. It won't let you submit until you answered the appropriate number. So if you're worried about missing one of the rows, it makes sure that the minimum amount is answered before it lets you move on. Then we have drop down close and then drag and drop close. These are a lot like the ones with the rationale, only these don't relate to one another. So if it's called a close item, then you finish the sentence, but the one doesn't necessarily relate to the other. And this is important whenever we look at how they're going to be scored. So you can do the drop down or you can do drag and drop. And so you can go here and drag over. This is just any findings that require immediate follow-up. It might ask you for the 3 priorities, the 5 priorities. So it can they will throw numbers in there as well. But you're basically just saying, here's the assessment findings, and you're dragging it over to the other side. And they can put drop down in a table format. I have seen quite a few of these in doing the different practice questions. I've seen quite a few of these with medications. So they'll give the medication, but then like with this one, they don't do the drug class or the client teaching. I have seen ones where medication is not filled out, but the other 2 sections are filled out. And I've seen ones where they have the medication and the dosage, or any follow-up or monitoring that needs to be done. But a lot of these drop-down tables I have seen mainly are medication-driven, pharmacology-based. You can have 3 to 5 options in each drop-down. And then scoring. Scoring is a little more complicated because it isn't all or nothing anymore, but it actually does help. So 0 to 1 scoring, that is something that most people are used to. If you get the answer correct, then you get the point. If you don't get it correct, you don't get the point. And if you have multiple responses, then all of the ones that are correct you get, but you don't get penalized if you get an incorrect one. On NCLEX, I have no idea what happened. Okay. On the NCLEX NGN test, the 0 to 1 scoring applies to multiple choice, the matrix multiple choice. So each row is a point. If you get that row correct, you get that point. If you get that row incorrect, you don't get the point, but you don't get penalized for it either. So if there's 10 rows, you get 8 of those 10 rows correct, you would get 8 of the 10 points. The drop down close, individual drop down, individual drag and drop close. If you get one correct and one incorrect, you get the point for the correct one, but you don't get penalized for that incorrect answer. But the bow tie, also, every one that you answer correctly, you get a point. You don't get penalized if you get one of those boxes wrong. There's an example. There were 2 correct. The one that has the red diamond was incorrect. So there were 2 correct. Don't get penalized for incorrect. So 2 of the 3 points is what this student would get. And then there's plus minus scoring. Basically, this is for anything where you could select every single potential response. So if there's no specified number of responses, then they're going to take the number that the test taker got correct, subtract the number that was incorrect to give them their score. The reason they do this is because on the select all that apply, if a test taker didn't know the answer and they saw that there were 6 potential choices, they knew if they selected all 6 potential choices, they would actually select the correct ones. But they're not showing that they selected the correct ones because they knew them. So this takes away the ability to just kind of select more than what you would normally select in hopes that some of them were correct. So if you select some correct and some incorrect, you actually subtract the incorrect from the correct to get your answer. And I have the highlighting as an option, but it's with all the select all that apply, the highlight text and table, the matrix multiple response, because that's a lot like the select all that apply. Same with the multiple response grouping. Basically, here I chose 3 correct, 3 and 2 incorrect, or 4 correct and 2 incorrect. So my correct minus my incorrect equals 2 points. If this was switched around, I had 2 correct and 4 incorrect, I don't get negative points. So it would just be 0 points. So there are no negative scores within that one question. The lowest you can get is a 0. Rationale scoring, the drop down and rationale and the drag and drop rationale, because the concepts are connected, and what the exam is attempting to assess is if the test taker can take the cause and come up with the correct effect, or the abnormal assessment findings to come up with the correct intervention, they have to get both correct. And let me show you the example. So they have to get both. This one's a triad, so they have to get this one correct, and this one correct in order to get the 2 points. They could get these 2 correct and understand the linkage between those 2, but then not get the linkage between this cause and effect, and they would get 1 of the 2 points. But if they did not select the right prioritization, even if these 2 were correct, they would not get any of the points, because it's that relationship between that cause and effect that is being tested. So this is one of the ones that tends to be the most difficult to understand as far as scoring. So if there's only one cause and one effect, it's 1 point or nothing. If there is one cause and two effects, or two causes and one effect, it's 2 points. So they could get one of two, 2 of 2, or 0 of 2. And that just applies to the ones that have rationale behind them. So drop down rationale or drag and drop rationale. So that is, in a nutshell, what to expect for the next generation NCLEX. It will start April 1st. So we're coming up in less than 2 weeks. And we are excited. I'm excited. References, any questions? I think Taylor.
Yes, thank you, Jaimee. That is a lot of information and
I know.
a lot of, but really good information, really helpful for our understanding as well, and obviously helping our students get prepared for that. So, like Jaimee's mentioned, any questions from the attendees? If you guys can just send your message in that Q&A box at the bottom of your screen, and we'll just keep an eye out for that, and then the appropriate individuals will answer your question.
So question was, does the bow tie have to match the upper left to the upper right box? So the bow tie, the way it is scored is each box counts as 1 point. What you will do whenever you approach the bow tie is you'll answer that middle box first, and then you will relate the interventions you would do with what you would monitor to that middle box. So does that answer your question, Sydney? So it's not testing, can you say that this intervention matches this evaluation? It's testing to say, can you match these interventions with this diagnosis or this, whatever the potential complication might be? And then can you also say what you would need to monitor based on what you know about that same complication? So the NCLEX, it's not necessarily broken into subjects. The way that the NCLEX works is it is a computerized adaptive testing method. So it will start with a question that's a moderate level question, and it can come from any of the topic areas that are on that NCLEX test plan. So it can be med-surg, it can be maternal newborn. It's anything that a novice nurse would experience or come into contact with after they graduated in their job. And then if you get the answer correct, it will continue to get increase in difficulty with each question. And then as you get them wrong, it decreases in difficulty. So it is completely randomized, and it's specific to the test taker as to how difficult the questions are and what difficulty level comes next. Taylor, that might.
Yeah, I was gonna say, it looks like there's a question there. Place to reference information we went over. Maybe Jason or Megan, can you guys jump in as far as where we would have this? I know we'll probably have it on our YouTube page, like our previous talk events. And I just got a message from Megan. It'll be on our YouTube page in 48 hours. So you guys can pull this recording there.
And I can tell you, Maria, the information that I took, and whenever I was making this, it either most of that came from the NCSBN website. So ncsbn.org, and they actually have a special link just for next generation NCLEX. And another really good resource, atitesting.com. you don't, so if you don't have access yet because you're not a current student, you can still go on atitesting.com. They have a student success page, and that has a lot of information, and it's worded in a way that is geared towards students. And so it has like a student pamphlet on NGN style questions. It has little videos. It has webinars, so you can go there as well. But then you can also look at my reference list and just copy and paste the URLs.
I think the next question here is from Sydney. If we don't pass, how long do we have to wait?
Hi, Sydney. Carrie Luma, Associate Dean of the Undergraduate Nursing Program. If you're taking your NCLEX in the state of Utah, Utah requires a 45 days in between taking your first and retakes. Just so you know, different states, if you take the NCLEX in a different state, they might have a little bit different requirement, but the state of Utah does have 45 days.
And then the next question here, does it lock you out after 85 questions if they determine you passed or failed?
Okay, so the way that NCSBN determines and the way NCLEX works is there's 3 ways that the exam will stop. The first way, you run out of time. So for April 1st and on, 5 hours, if you reach your 5 hours, it stops you. If you run out of questions because you only get 150 questions, that stops you. If you get 85 questions and you have a 95% chance of passing or failing based on those first 85 questions, well, 70 because that's all that's scored, it will stop you as well. So those are the 3 ways it will stop you.
And we have the next question here. Will it still be CAT styled? I believe that's the adaptive style.
Yes. So the way that works, Maria, because they do have the case studies as a whole are also weighted on difficulty level. So you will still have that adaptive testing. Once you get into the case study, those 6 questions are the same 6 questions for that case study. So once you enter that case study, you will get those 6 questions. Those questions within that case study don't change based on how you answer it. But if you had a case study that was moderately difficult and you did really well on that case study, then the next case study will be more difficult. And then the other standalones are still the CAT style.
Next question here is, how soon after finishing school can you take the NCLEX?
Dr. Loma?
Sure. We do encourage everybody to take the NCLEX as soon as you can after graduating. So what happens is you'll apply to the to Pearson Testing Company as well as the State Board of Nursing. And once you get everything and your money for $200, I believe it is for the Pearson and the state state licensing rate, you'll pay that. The school will send in your approval letter to saying that you finished. As soon as you can take, you should take it. I would think about a week to 2 weeks after you graduate, you can take it. The longer you wait, unfortunately, you have a decreasing chance of passing. So we do encourage everybody who's ready to, pay for Pearson, the testing company, and then submit your documents to the state in which you're going to get your license. And then we will do what we need to do to send the Board of Nursing our documentation stating that you've graduated. So I've had students test within a couple weeks after graduation.
And keep in mind that some times are going to be busier than others.
Mm-hmm.
So if you're graduating in the spring, when there are a lot of programs graduating around the same time in May, it might take longer to get a testing time. So you don't wait to sign up for your test date because you don't want to take it, like I don't want to take it this Friday, so I'm not going to go in until Monday to try and test. You want to make sure that you go in and you sign up early so that you can get the testing times that you want, because sometimes there is a little bit of a wait.
And sometimes depending on where they have the testing site, it might take you a little bit, you might have to drive a little ways to get your testing. So I would start looking at the Pearson testing site, site as well as the State Board of Nursing, just to become a little bit familiar with what their expectations are. And then there's a question on what is the passing score. So so passing is going to be looking at the probability of you being able to meet the competencies, and they're looking at with a 95% probability of meeting that competency. They do not give us a score anymore. They used to back in the early 90s, but right now they just say if you've passed or not. They do not give you a passing score.
Perfect, thank you guys. Are there any other questions out there? All right, I will take that as a no. Well, I appreciate Jaimee and Carrie. I appreciate your guys' time here today and answering the questions. If there's any additional questions that someone might think of after the fact, do you guys have any recommendation on the best way to reach out or anything like that?
If there are any questions, you can email me. I have no problem answering emails. It's jaimee.kastler@joyce.edu. If you have questions specifically about NCLEX, the NCSBN website is a phenomenal website, and they do have an area that's specifically just for students, and it has frequently asked questions. It tells you step by step the process whenever you're ready to apply. And it has little videos, tutorials. So I really do recommend going in on that website because there's so much information there. And they even have, if you had more questions or wanted a refresher on the item types, they have like a 1 or 2 minute video that introduces each item type. So there's just so much information on that website. You can usually get most of it there. But if you had something specific, you can email.
Perfect, thank you. And it looks like actually we just got a flood of a couple more questions here. So next question is, how long does it take the school to send over the info to be able to register?
So what typically happens, we have to make sure that you've graduated and completed all your course requirements. So it takes a little bit after the grades are posted. I don't know the exact date. I'll have to ask Dr. Haskell the exact time because he's the one that does complete those for us. But as soon as your transcripts are, everything is completed on your transcripts, they do a transcript review. We will electronically submit that. So it doesn't take long. Usually it's a week to 2 weeks, depending on, if you had an extension on, if there was an incomplete and you had an extension or anything like that. But after we are able to confirm you've graduated, it usually takes a week or 2 to get it over. So we do recommend, or I do recommend once towards the end of the semester to get your money into the Pearson Testing Company and the State Board of Nursing to get that ready. So it's ready and prepared when we do submit our transcripts.
And the
requirement, sorry.
That's okay. Next question here is, how quick do the students learn if they pass the NCLEX?
Usually it is a couple days. You can do that online. There is a method, I believe it with Pearson, you can pay to see it earlier. I'm just not so sure how it works right now. Because with COVID, everything changed a little bit. Jaimee, do you have any more details on how quick? I believe it was a couple days.
Yeah, you can pay to find out within 24 hours. They call it unofficial, or you can wait the 48 hours. And that's business days. So you have to go off of business days, not the weekends. And I don't know how much it costs now because it changes. So if you want to find out and you can't wait 2 days, you can find out in 1 day unofficially. You just have to pay for it. What I do not recommend doing, because I have heard this, students will say, well, I went ahead and I tried to sign up to test for it again and it wouldn't let me, which means I passed. I have had students try that and it lets them sign up and it takes their money and then they passed and they didn't have to take it again anyway. Pearson will not give you your money back. So don't do
Good
that.
tip. Very good tip. All right, so we've got about 5 minutes left here. Any other last questions? All right, well, with that, I will conclude that today and give you guys 4 minutes back to your day. And I, again, appreciate all of your guys' information and answering these questions for our guests here. Have a great night.
Thank you, Taylor.
Thank you, guys.
Bye.